And a good Saturday morning, too. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic, located at 4855 East State Street in Rockford, Illinois. And Dr. Jim told me before the program we're going to talk about something we've never talked about before.
Absolutely. And the proper name, Fred, would be chiropractic biomechanical X-ray mensuration analysis.
Oh, hold on.
Let's make it short, though, okay? And chiropractors call it spinography. And spinography, Fred, is a way of reading X-rays that gives you a lot of information that otherwise you wouldn't have.
Spinography. Now, that's much easier than what that other long thing you said.
Well, here's what it is, basically, Fred. When someone goes somewhere and gets X-rays, let's say it's to a hospital or a medical facility, and what they look for is to see if there's any fractures, if there's maybe a separation somewhere, maybe a bone disease, cancer, whatever they're looking for. They're looking for pathology or some type of injury. Whereas with chiropractic X-rays, we do that also, but we also try to see what the joint looks like as far as its alignment is concerned. In other words, let's say somebody has one leg that's a half an inch or an inch shorter than the other one, and if you took an X-ray standing, you would see that one leg was longer than the other, or one hip would be higher than the other, or so. Those are different things that you'd look for. Whereas if you took that X-ray lying down, you wouldn't be able to tell if one leg was shorter than another. It might look normal when you take it in a non-weight-bearing position, but in a weight-bearing position, you start seeing where there might be a problem. So you can actually read X-rays when they're in a weight-bearing position, and you'll get a lot of information that you would not get in a non-weight-bearing position.
Now, you've mentioned that before when we've been talking about other subjects, how you like to have people stand up when you're doing an X-ray for that very reason. Is that commonly done when doctors are taking X-rays?
That is common with chiropractors, but not so much with the medical profession. And so with chiropractors, you need to know X-rays from a medical standpoint and from a chiropractic standpoint where you want a biomechanical analysis, or take the X-rays in a weight-bearing position. And then there are certain angles and measurements that you take that will diagnose a problem.
So is this what you mean by spinography?
That's what we call spinography. And that's kind of a pretty specific to the chiropractic profession, because other professions don't really look at X-rays that way. And that's why sometimes people might have a medical X-ray and not show a problem, and go to a chiropractor, and the chiropractor finds a problem, and it's because he or she is reading that X-ray from a biomechanical standpoint and not just from a pathological standpoint.
Well, now an X-ray can show a break, and that's usually the way you think of an X-ray. There's something broken, and the X-ray will reveal it. But in chiropractic, the bone itself might be okay, but the alignment is what you're concerned about, right?
Absolutely. And using that leg length analysis, that's kind of the first thing that I do when I X-ray patients. I want to see are the legs even? Because if something is crooked further up in the spine between their shoulders, their lower back, or even in their neck or their head, if one leg is shorter than the other, Fred, that will affect the whole spine. And so when someone comes in and maybe they're having headaches, maybe they're having sinus problems, maybe they're having neck, shoulder, arm pain, and you look at those and you see that their hips are uneven, well, you can work on the neck all you want, but if you don't get those hips even, then you're only treating a symptom and not getting to maybe the cause of the problem. So we always look below where the pain is to see if we can find something that might be causing the abnormality, which leads to the pain.
Well, X-rays, as I mentioned, can show a break, but you're looking for the alignment thing here with the spinography. But say you find that a person's hips are not aligned properly. I know that in some cases you've had people use lifts, but in other cases you can restore the function so that the two are equal, the two sides.
That's good. You're correct on that. Yeah, many times we will take a look at that and we'll see that one leg is shorter than the other, and that tells us pretty much how much of a lift we need to put in there to balance that out. Now, if you think of this, Fred, if you're low on one side, then that hip is going to be low on that side, and then your body is going to lean to that direction.
And it affects everything else.
Yeah, and then your body will try to compensate because it's leaning too much in one direction, and it'll lean in the other direction then above that area. So let's say your right leg was short, your body would lean towards the right because the leg is short, but then your body might lean to the left, and which would mean that that right shoulder then would be high on that side because it makes like a big C in your spine. And so then if that right shoulder is high, your body might have the head turn in the opposite direction to try to balance, where your writing reflex, where your eyes are trying to stay in a horizontal position. It can cause an S shape in your spine then. It's first a C and then a C in the other direction, and you end up with an S. And so a lot of times people have a scoliosis or a curvature in their spine, and it's because one leg is shorter than the other, where you put a lift in that spine, in that shoe, and then you start adjusting the spine, and then you can many times get that curvature to straighten out. Now, you mentioned also that the one leg might not be shorter than the other, but there could be an uneven, and that happens a lot of times when there's maybe a twisting that takes place in the hips. And so chiropractic adjustments can fix that, adjust it in the opposite direction so that the legs then are even and the hips are not twisted, and then that helps straighten it out too. But an x-ray is necessary to know, do you need the lift or don't you need the lift?
So basically you can fix the problem one way or another. If it's an actual shorter leg, a lift will even things up and cause better function. Or if something is out of whack, you can readjust it.
Yes, and the x-ray helps you to determine how bad it is and gives you an idea maybe of how many treatments might be necessary depending on how bad that misalignment is. Now, another thing that we do, Fred, is we might take an x-ray from a side view of the low back and hips, and we can measure the tilt of your sacrum or your tailbone, how much that tilts. Now, if it tilts too much, if it tilts 45, 50 degrees, then that's telling you that there's a jamming taking place in the lower part of the back, and you can tell that just from the measurement.
When you say jamming, what do you mean?
That means that the bones are kind of in extension in the lower back, and they're maybe rubbing together, and the gravity line shifts, and so that tells us what we need to do to fix it, and you can tell it just from a simple measurement. And that's a very important measurement that we use to determine low back pain. Many times that'll tell you where the problem is just by what the measurement might be. And on the same token, maybe people have headaches, and you take an x-ray of the neck, and you can take measurements then of the bones of the neck, and it'll tell you, oh, this person's having headaches because it has this measurement or that measurement.
Now, when you look at an x-ray, are things like that obvious, or is the measurement necessary, or do they sometimes just stand out?
Well, many times it's obvious, but it might be obvious to me and not to my patient. And so when I have patients come in there, I want them to know what the problem is. If there's a problem, a misalignment in their spine, I want them to know that. And so I'll draw the lines on the x-ray, and I'll show them, and I'll show them this measurement, and then I'll show them what a normal x-ray would look like, and then I'll show them what their x-ray looks like, and then they can see for themselves where the problem is, and that makes it crystal clear to the patients.
Now, I know that when you start out with a new patient, a patient that's been there for the first time, it's common procedure to do an x-ray, isn't it?
Yes, we do that with almost all of our new patients.
How often, what percentage of people that come in have some type of problem once you look at an x-ray?
Well, probably most of them. If you're looking somewhere, you're going to find a problem. One way to look at this, Fred, is kind of like, and this is how it actually started. Some of the early chiropractors, before they went into chiropractic, they were into architecture and such, and they knew what these force lines are, like on a bridge, for instance, where the gravity lines are and where it's going to sag and where you need to build it up on. And they used those principles on buildings and looked at an x-ray and said, well, gee, it's low on this side, or the weight is leaning on this side. And they used the same principles that you would use in something very mechanical, and then applied that to the body, so that's what we call biomechanical, something living, but it's still dealing with mechanics, simple mechanics.
So an X-ray of somebody's spine, from the front, from the side, can be a good tool in assessing or diagnosing a problem.
It's necessary. It's not only a good tool, Fred, it's absolutely necessary, because if you don't do that, you don't see what the problem is. And we've got a little sign in our office that says, to see is to know, and not to see is to guess. And we won't guess about your health. And so that's why we are very careful to take proper X-rays. And we're not talking a lot of X-rays. We're just talking maybe a couple X-rays from a couple different angles, and draw the lines, and that'll tell us how bad the patient is. And then also, we might want to take an X-ray several months down the line.
I was going to ask you if you do before and after to see if there's been an improvement.
And then show it. And you can tell them, you're 25% improved, or you're 50% improved. Well, how do you know? Well, because you were a 10 degree and now you're only a 5 degree. So you're 50% better. So that's how we can gauge improvement in patients, but also use it as an educational tool to the patient, so the patient can see what we need to do.
And of course, the proof is in the pudding, and that part of that is the reason why chiropractic has become so popular and useful to so many people, is because they feel better and they know that something has been healed.
Yes, and people want to feel better, and we want our patients to feel better also, but sometimes you have to see an improvement first. In other words, a lot of times your body needs to be corrected before the symptoms start going away. And a lot of times we can say, you're 50% better, and they say, well, I don't feel 50% better, but we know they're coming along because we can measure that they're definitely better. On the same token, sometimes patients feel better before they're well, and they say, gosh, I feel 100% better, and we check them and say, well, you're about 50% better, but I feel 100%. And we know if they were to quit chiropractic treatment too soon, then the problem would come back again. And so we don't want the problem to come back again. We want to fix the patient.
All right. The easy term is spinography, and it involves the use of X-ray. And I'm sure if people have questions, you have more answers for them.
They can contact us on the web, www.warnerchiropractic.com or warnerchiro.com. I guess, forget the tick. warnerchiro.com, and they can call us at 815-398-8111.
398-8111. Warner Chiropractic in Rockford with Dr. Jim Warner, and thanks so much.
Thank you. Have a wonderful day.
And that'll wrap it up today for Health Matters.